Now, from ABC4 News, coronavirus preparation versus panic.
Thank you so much for joining us tonight for this special presentation, Coronavirus Preparation versus Panic. I'm Glenn Mills. Tonight, we are answering questions sent to us by you, our viewers. We have received dozens and dozens of questions about coronavirus, just like this one. How long can the virus live on clothing? I work construction and wonder if the mud I get on me that everyone walks on can infect my clothes, gloves, etc. We reached out to the Salt Lake County Health Department to help answer some of these questions.
So first of all, it's important to remember that the greatest transmission risk for COVID-19 is the respiratory droplets from an infected person. So if you stay out of range of respiratory droplets from another person, you're not going to be at any significant risk. Now, we know from studies about respiratory droplets that they only travel up to 6 feet from the human producing them. So that's the most important thing to remember. You stay 6 feet away from other people, their respiratory droplets that may or may not have COVID-19 in them cannot reach you. Now back to the question, clothing specifically. We don't know how long COVID-19 might survive on clothing, but we don't consider it a significant transmission risk. If someone in your household has COVID-19, you should handle their clothing a little bit differently than you would normal laundry. You want to wear gloves when dealing with the infected person's clothing. You want to wash that clothing, and you can do it with other laundry. It doesn't have to be separately, but you want to wash that laundry with the warmest water setting appropriate for the fabrics. When you're done with the laundry, putting it in the washing machine, you can take the gloves off and then wash your hands.
We will continue to answer your questions throughout the show. Many viewers who have lost their jobs also want to know what resources are available for them. To file for unemployment insurance, visit jobs.utah.gov. Resist the temptation to call in to check on your claim. Compared to last year at this time, Utah is experiencing 10,000 to 20,000 more unemployment claims, and that number keeps growing.
Some of the trained resources that could actually be processing that work might be pulled to answer calls. And so what we're trying to do is strike that balance to be able to be available, but not fall behind in the processing, because in the end, that benefit is the key to help stabilize someone economically.
You can find out what you need to file a claim by visiting this story on our website, abc4.com. And small business owners can now apply for government grants and loans to help with the impact of the COVID-19 pandemic. Young Hum of Milt's Shoe Repair in Sandy says he's making only $10 to $20 a day. The business first opens its doors in the late 1980s. Now it's in jeopardy of having to close. To make up for the loss in sales, he's applied for the Paycheck Protection Program, or PPP. Like many, he's worried about what will happen if it doesn't work.
Stay home. It's a problem. So my house is payment, the utility, food.
Now, if approved, the PPP would provide federally guaranteed loans to eligible small businesses up to $10 million for an 8-week period. Other options include the Economic Injury Disaster Loan to help meet working capital needs caused by a natural disaster. The Salt Lake City Emergency Loan Program is also for small businesses seeing a downturn due to COVID-19. People who are about to become parents have a lot of questions about what the pandemic means for mom and baby. One Syracuse couple's newborn daughter arrived 3 weeks earlier as the pandemic took off and then the earthquake hit the Wasatch Front. ABC4's Rosie Nguyen talked to the family and has some tips from a doctor for those who are still expecting.
Preparing for childbirth can be a stressful ordeal, even for second-time Syracuse parents McKenna and Mitch Tulane.
You are getting a nursery ready, you're trying to make sure you have everything that you need for the baby.
Baby Jersey came 3 weeks ahead of schedule on March 16th, just as the COVID-19 pandemic took off here in Utah. Compared to the birth of their first child, getting admitted into the delivery room took longer because they had to be pre-screened for symptoms and travel history. They also weren't allowed to bring anyone else inside.
We'd always planned, we had this, when Jersey was born, Abby's going to come to the hospital, she's going to meet her, our parents are going to come and meet her in the hospital, and those things were all thrown out the window very quick.
On their newborn baby's first night home, the 5.7 magnitude earthquake hit the Wasatch Front. The stressful ordeal kept the family inside since then, and with orders to maintain social distancing, baby Jersey hasn't been able to meet any of her other family members.
Take it day by day and be as careful as you can. I think everybody's really scared right now, and everybody's doing their best to try to stay healthy.
Doctors say for the most part, expecting mothers should anticipate the same type of maternal care and labor experience from their physician. Make sure you have a conversation about what you should do if you begin to experience any symptoms of COVID-19.
One of the changes they may see in their prenatal care is that we as physicians are trying to do as much telehealth as we can just to minimize patients' exposure to our clinics and to hospital settings.
Reporting for ABC4 News, I'm Rosie Nguyen.
Dr. Eller says at this time there is no information to indicate that COVID-19 can compromise a pregnancy, nor can it be passed from the mother to the baby. But she says let your doctor know if you're experiencing symptoms so they can monitor your condition closely. Still ahead, we will answer more of your questions, such as how effective is hand sanitizer at killing viruses? That and what you should be checking for on the label next.
With the massive impact of COVID-19, we visited the Salt Lake County Health Department for the proper and effective way to wash your hands.
Okay, so I'm going to contaminate myself. So, start by wetting your hands, getting the soap, and you want to lather first, palms together. And you do the backs of your hands, and then interlace your fingers with palms together to get between your fingernails, or between your fingers. And then you clasp your hands like this and rub back and forth, and that kind of gets the backs of your fingers as well as your fingernails. And do the other side. And you want to make sure you get your thumbs. It's kind of a circular motion around your thumbs, other thumb. And then the palms of your hands, you do the fingertips around the palm in a circular motion. Get your fingertips nice and clean. And the other hand. And then my wrists. And that was 7 different steps. And if you do those 7 different steps for about 3 seconds each, you're going to get your 20 seconds of wash. And then I rinse it off and use my paper towel. Just the basic things of keeping yourself healthy. And those are the ways that you can help reduce your risk of getting sick and risk of passing on illnesses to others.
Curtis Booker, ABC4.com.
You're watching Coronavirus Preparation versus Panic.
Welcome back. Tonight we continue to answer your questions about the coronavirus. Many viewers are wondering about the most effective ways to protect themselves and their families from the virus, like this family. I have heard that hand sanitizer has to have a certain amount of alcohol, but I've heard others say they don't need any alcohol. If they do have to have it to destroy the virus, how high of a percentage? We took these questions to the Salt Lake County Health Department.
First of all, hand washing is better than hand sanitizer. When you wash your hands, you are physically removing those particles from your hands. They're not just dead or deactivated. They're physically gone and washed down the drain. So that is the best thing you can do. Now, if hand washing is not available to you, hand sanitizer is an acceptable second choice. And to be effective against COVID-19, that hand sanitizer needs to be at least 60% alcohol.
Another viewer wanted to know this. Do I need to clean items brought from the grocery store? And here's what Nick Rupp of the Salt Lake County Health Department had to say about that.
The answer is probably not. It is probably not necessary to clean food packaging after you bring them home from the grocery store. First, the CDC reports that while the virus may survive on some surfaces, such as metal and plastic, for up to 72 hours, there are no documented cases of transmission from food packaging or even from surfaces. The FDA also reports that there's no risk from food packaging identified to date. The most important thing you can do after being at the grocery store is wash your hands as soon as you get home and before you unpack your groceries.
Right now, we are all trying to balance social distancing with the need to keep in touch with our friends and loved ones. That led to a question like this. I am 70 and my husband's 72. We have no underlying health conditions. Is it safe for us to stay in our car and talk to our children while they are on their lawn over 6 feet away from the car? Our visits usually less than 20 minutes.
Yes, that is a perfectly safe way to find some family time together without putting yourselves at risk. Again, since we know that the virus is primarily transmitted through respiratory droplets from an infected person, and respiratory droplets only travel up to 6 feet away, as long as you're staying 6 feet away and you're in that car by yourselves with household members, there's no problem with socializing through an open car window as long as the other people are at least 6 feet away from you.
In addition to staying 6 feet apart from people when we are out in the public, state officials are asking Utahns to stay safe, stay home. ABC4's Haley Hendricks takes a look at why this is so important for each of us to follow.
Utah officials continue to ask you to practice social distancing as it's a way to keep you and others safe and healthy in an effort to limit the spread of COVID-19.
We need to engage in what we call appropriate social distancing.
These social distancing measures are going to have to be a way of life for Utahns and for the U.S.
It should be at least 6 feet.
And we just need to continue those efforts moving forward to continue to see the decrease in the rate of cases.
Time and time again, Utah officials are reiterating the importance of practicing social distancing as they believe early action may reduce the severity of the pandemic's peak, flattening the curve. The Washington Post published preliminary data from the 2 weeks of stay-at-home orders in California and Washington. These two states saw some of the first COVID-19 cases and issued stay-at-home orders early on. That data shows that social distancing is working. When seeing large groups here in Utah, some are taking their frustration to social media by saying things like absolute stupidity. Who allowed this to happen? And unfortunately, some people just don't get it. Salt Lake County is under a mandatory stay safe, stay home order, and Sergeant Sam Winkler with the South Jordan Police Department says his team has responded to some calls of people not obeying the order.
So we'll go out there, we'll talk to them, remind them of what the county health is, and see if we can get them some compliance at that point. We want to use enforcement as a last-ditch chance.
As part of the Stay Safe, Stay Home order, this includes not going to visit friends or family unless absolutely necessary and minimally visiting essential businesses. Reporting in Salt Lake County, Haley Hendricks, ABC4 News.
Still to come, we've talked a lot about the proper way to wash your hands to avoid spreading illness. But what about the right way to disinfect surfaces in your home? An environmental health scientist walks us through the steps next.
You're watching Coronavirus Preparation versus Panic.
A question a lot of us have is how long can coronavirus survive on surfaces? And how can we clean those surfaces in a way to make sure that we are limiting its spread? Joining us now is Andrea Gamble, environmental health scientist with the Salt Lake County Health Department. Andrea, great to have you on the show. Thanks so much for being here. Let's start with how do we have any idea of how long viruses can actually survive on surfaces?
So this is a new virus, but experts think that it can last on a hard surface for a couple of days.
Okay, so that's quite a while that it can be put on the surface and you can come pick it up later. So when we clean, what are the supplies that we're going to need to make the most of that?
So the health department recommends using chlorine bleach. It's the very best thing. And you want to dilute it about 1 teaspoon per gallon of water, and you can just put it in a spray bottle, and then you can actually spray the surface, and the contact time is about 7 seconds to kill the germs.
Okay,
and
so that one's going to work really fast then?
Yes, very fast.
And when we're doing that, you're kind of giving us a demonstration here. Is there a proper method you should use, or how much are you actually spraying down to clear that amount of surface there?
Just enough to make the surface visibly wet, and then you want to wipe it with a paper towel and then allow the rest of it to air dry.
Okay, and after about 7 seconds, that should take care with that ingredient, get the coronavirus off that surface.
Yes, and people often think, well, if a little bit is good, more is better, but that's not the case, especially on a food preparation surface. If you use more, you could actually cause chemical poisoning.
Okay, very good point there. We were talking during the break, and you said something that really surprised me, because the wipes that you're gathering there now, they're very popular, but they take a lot more time to be able to actually be effective against the coronavirus. I was surprised to hear what you told me there.
So if you read the manufacturer's label, it says you have to keep the surface visibly wet for 4 minutes. So that would take, you would have to wipe the surface with a few wipes. And then if you continue reading on the label, it says that you have to rinse with clear, clean water. There's fragrances and chemicals, so on a food prep surface, you would have to wipe it off. Okay. So these are really good for doorknobs in the bathroom, but when you're in the kitchen, you want to make sure that you're using bleach.
Okay, very good. What other ingredients should we be looking for when we're looking for the most effective cleaner?
Bleach. Chlorine bleach is the most effective cleaner.
Okay, what about ammonia? People think that, or vinegar even. Any recommendations on those two?
So the health department recommends bleach, and then in the sanitizing wipes, the sanitizer is quaternary ammonia or quats, and that can be effective as long as it's on the surface for at least 4 minutes.
Mm-hmm. Okay, so talk about the importance of all this. You kind of showed us how to do it properly there, but talk about the importance of getting into the kitchen and really doing a deep clean, or even other surfaces throughout the home as well. How important and crucial can that be?
It is very important to clean and sanitize your surfaces, especially doorknobs, light switches, anything that is a high-touch area.
Okay, and then as far, I mean, obviously we're in the kitchen now, but I would imagine bathrooms. What other areas are we wanting to look at and make sure we're getting them clean there?
So anywhere that people are touching a lot, so in your bathroom, the flusher, just things that we don't think about that everybody is touching. The faucets on your sink, just anywhere people are touching.
Mm-hmm. And this obviously, if you're not taking these precautions, what kind of detrimental impact could it have?
So cleaning surfaces is very important, but the most important thing we can do is social distancing. We want to stay away from someone, especially if they're coughing or they're visibly sick. Okay,
so that's even within the walls of our own home?
Yes.
Okay. All right, very important information, Andrea. We appreciate that. Again, I was quite surprised to hear the information you had on the wipes. Didn't realize you needed to really be at it for that long with those. Very popular product, and thank you so much for your time. We appreciate it. Coming up, we answer your questions about how pets could be affected by the pandemic and how you can help their owners who may be struggling.
You're watching Coronavirus Preparation versus Panic.
Welcome back. As medical officials throughout southern Utah continue to closely monitor the COVID-19 pandemic, administrators at Dixie Regional Medical Center in St. George say they're prepared, and it's all because of emergency planning that was already in place. St. George is considered a high-risk population, with 19% of Washington County residents considered elderly, as well as a portion of the population with comorbid conditions, such as heart disease. Hospital leaders say they have to keep their foot on the gas pedal. The hospital is licensed as a 284-bed facility and can open several hundred more if needed, including 40 at a moment's notice that are currently in the building. In this time of crisis, pet owners have expressed concern for the well-being of their pets and wonder if they play a role in transmitting the virus. One viewer asking this: if an infected person who may have the virus on their hands then pets a dog, can the virus attach on the pet's coat/fur? If so, how long will it live? I foster dogs, and they may be handled by many people while in my care. Here's Nicholas Rupp from the Salt Lake County Health Department.
We don't know how long the virus may survive on a surface like pet's fur, but we have no indication that pets pose any risk at all for the spread of COVID-19.
Even though health officials say pets do not pose a significant transmission risk, they are still impacted by the pandemic. If their owners are struggling in the current economic climate, some pets might not be getting the basics. ABC4 senior health correspondent Ray Chin explains how you can help.
The coronavirus on everyone's minds, and not only our minds, but maybe our pets. We want to bring in Tema Martin from Best Friends Animal Society to talk about a couple of things. One, can animals get it, and can they spread it to humans?
All of the health experts, the Centers for Disease Control, World Health Organization, American Veterinary Medical Association, at this time there is no evidence that pets can either contract or spread the virus. So please don't be suspicious of your pets.
Don't abandon them. In fact, there are so many benefits at this stage in time to keep your pets close.
Exactly. Studies over decades have shown that contact with pets reduces anxiety and reduce stress, make us less depressed. And so this is really an important time to let our pets comfort us and keep them in the family, but also prepare for them. So have 2 weeks to a month's supply of pet food, litter, any medications, just in case, so that we can keep our pets home and safe with us, because a lot of shelters are actually working with reduced or,
like so many businesses right now, we
Yeah.
have limited staff. Have you seen an influx of people wanting to give up their animals at this time?
Locally, we have not yet, but it's a reality that's hitting very hard and very fast. People are losing work hours. Some businesses are closed. People are going to be losing income. So it is a concern. Some people are worried about what if I get sick? What do I do with my pet? So plan for that. And really, we're asking people to help each other out. If you have a friend or a neighbor or a relative who is losing work hours or can't go to work, please offer to help them. If you can get your hand on bags of cat food or dog food, help them out so they can keep their pet at home.
Now more than ever, we need to work as a community, as a team. If someone, your neighbor, is having a tough time, that is when you might step up and say, can I take your pet for a week? Can I bring some dog food for you? What can I do to help out?
Sure, you can help each other out in your own neighborhood, but shelters and rescue groups are also asking for people to adopt and foster at this time, because these pets, they need help, and if shelters are closed or, limiting access, the pets need somewhere to go, so you can find out how you can reach out and help.
All right, Tema Martin from Best Friends Animal Society, and a great resource there, and also the CDC when it comes to animals.
Yes, the CDC is always posting updates, and it's a good place to get information. You can go to bestfriends.org or utah.bestfriends.org to find out about other resources in Utah.
Tema, thank you so much for this important message.
Thanks, Ray.
That does it for us tonight. We'll see you back here at 10.